The only thing we want to say is that as we go about celebrating, we should still be a bit mindful. We are celebrating Easter for the first time in about 2 years without any restrictions, which is good news. But people should still take personal responsibility concerning their health. And in relation to COVID, we are asking that if you're having any symptoms, please make sure you use your mask before you go into a public space or into indoor events. If you're having a cough or any respiratory symptoms, report to the nearest facility so you'll be assessed. We are also aware that vaccination is still ongoing, and if you know that as of now you are not yet vaccinated, make use of the opportunity available at the various health centers and get yourself vaccinated. Some campaigns are coming up soon to wrap up our numbers well, and we'll ask all the unvaccinated persons to join. But let's enjoy our Easter for the first time without restrictions, but still mindful that even with just 3 cases in the country as of now, things can escalate. And therefore, let's protect ourselves well.
The suggestion is that the president should have waited at least for the Easter period to be over before he goes ahead to reverse the restrictions. What's the position of the Ghana Medical Association on this?
Well, the GMA holds a very different view on that. The GMA is informed by the data that is available to us and by the science available to us that the timing of the release of these or lifting of these restrictions is appropriate. There's no justification to slow down economic activity, continue to restrict people's movement and gatherings and living of a normal life when your case count is just 2 and you are having vaccine uptake. And remember, the restrictions itself also pose a health challenge where people are having mental health issues. Our inability to associate and live a normal life has mental health concerns. And so if there's any opportunity for people to vent out, to get themselves excited, to celebrate, I don't think we should deny them of that. And I think our data as of now suggests that there is nothing wrong with us lifting these restrictions at the time the president did.
Well, the issue is this is a contagion, and the fact is once you have a confirmed case, at least there's that fear that you could have a further spread if these events are not checked and that we don't have the protocols in place. Should that not be of concern to us, particularly as we're in the season of Easter?
You know, in the previous years and months, our understanding of this disease was not as we have it today. Our preparation as a country was not as we have it today. The capacity of our health system to respond to a spike in cases was not as we have it now. So I think the point of view of the scientific community and the medical community is that we need to balance things. If we want to continue to impose these restrictions so people can, we can minimize any slight risk of spread, you have to look at the other side of the impact of that on our health system, on our economy, and on life in general. Like I mentioned, there is a lot of psychological and mental health issues when people cannot associate as they have been socialized to. And the burden of that disease moiety, which has been brought about by these COVID restrictions, has not been fully assessed yet. So in that background, I would say that if there is that risk, yes, that 1 or 2 cases may spread or may come up, but our systems are better positioned now to handle those cases. And so we should not deny people the opportunity to celebrate and associate.